We have Dr. Chantal Basson, a clinical psychologist and family systemic practitioner at the Cayman Islands Health Services Authority. Her topic today is Mental Health is Everyone's Business, the why and how of everyday therapeutic interactions. It's such an important and relevant topic. Dr. Basson specializes in attachment-focused family therapy, chronic long-term health conditions, psychosomatic presentations, neurodiversity, and healing trauma through the development of attachment relationships. She has qualifications in several therapeutic approaches, including family therapy, dyadic development psychotherapy, theraplay, autism assessments, and EMDR. Dr. Basson is an executive board member of the Cayman Islands Psychological Association and is the clinical and education committee lead for the Alex Panton Foundation. All that said, it means she's somebody we should be listening to. So please join me in welcoming Dr. Basson.
Thank you so much. This is the moment that I wish I had my daughter's step that she uses to reach up to the sink when she washes her hands. It's such a pleasure to be here today. It does not pass me by that I am stood talking about mental health at a general health conference, and that is an incredibly privileged position to have. I was really struck by Dr. Mehta's words this morning when he gave that incredibly inspirational talk about healing cancers. That he said, if we take care of health, we may need to take care of illness less and less. And I feel exactly the same about mental health. If we take care of mental health, we may need to take care of mental illness less and less. And I want to take you back to his presentation when he looked at the cake. And he was talking about, new word of the day for me, quaternary care. Love that word. And he was talking about quaternary care. And today I'm going to be talking about the really big 16-inch cake at the bottom, because that's where mental health is everyone's business. Okay. So, with that being said, we're going to go on a bit of a journey today. I'm going to take you through the data, first of all, because the data is our why. Without data, we have no why as to what I'm doing talking about this today. And then we're going to look at understanding mental health, not from an illness perspective, but from an everyday perspective, looking at the external factors of mental health. Why do they cause mental health difficulties and challenges? And then looking at the power of everyday therapeutic relationships and the power of empathy. So, the data. The Cayman Islands Student Drug Use Survey 2024 data has come out, and I was in the privileged position to listen to some of those results recently. Only 14% of our students, that's 14% of nearly 3,500 students who filled out the survey, reported that their mental health was excellent. That's a tiny, tiny proportion of our population of youth. Whilst mental health education in school has improved, and we have a really great emotional literacy program that's rolled out in all of our government primary schools and some secondary schools, there are still ongoing issues. Stigma also has reduced. That is what the drug use survey shows us. However, 35% of students report that their mental health is either poor or only fair. That's 1/3, more than 1/3 of our young people population. That is massive. What we're also seeing is that there is a peak of anxiety in grade 9, so around 14-year-olds. And I felt so validated when I saw that data, because most of the people who sit in my therapy room with suicidal ideations are 14-year-old girls. It's not then that surprising, but also totally terrifying to see that 1/4 of students have self-harmed by cutting. Again, that's an enormous percentage of our population, and that's just what people are reporting. as my learned epidemiology friend said before, people underreport in these surveys, and it's likely that that is an underreport of the data. So, whilst we have some great mental health education going on in schools, there's still a disconnect in an overall approach, not only in schools, but in general, and we need to look at closing that gap. And we can do that by understanding mental health as everybody's concern. So what about the HSA data? Well, in 2021, the Mental Health Commission annual report that came out in 2022 said that we had 107 admissions to HSA with somebody who had an attempted suicide. That was a 72% increase from 2020. That's not a massive shock since we were in a global pandemic and people were locked down, but it's still an enormous leap. And we've already had this number. We're well beyond this number in 2024. So there's been an exponential growth since 2021 to date that we're seeing, and it means that we have entered into a mental health crisis. So I'm going to talk for a moment about adverse childhood experiences, and then I'm going to explain why I'm talking about that. Okay, so what are they? They are violence, abuse, or neglect in the home, witnessing violence in the home or community, having a family member attempt or die by suicide, having emotional or physical neglect, parental separation or divorce, domestic violence I've already mentioned, household substance abuse, household mental illness, and incarcerated household members. So ACE's data is really important, but there's something very stark missing from this data. And I wonder if anybody can see what it is, given if people look around them in this room. It's the impact of ongoing systemic racial discrimination. That is also an adverse childhood and adult experience. And the effect that that has on our cortisol levels in our body is really important, and I would argue that racial discrimination and bullying, long-term bullying, needs to be added to this data so that we can start to understand the impact of it. Unfortunately, from a global perspective, guess who developed it, right? Guess who developed it? It needs to be added. Okay, so the ACEs data is really interesting, and in 2017 there was the biggest meta-analysis done of ACEs data by Hughes and Bellis, and they studied research that came out up to 2016. They looked at just over 11,500 articles, and it covered more than 250,000 participants. So it's the biggest study of its kind to date, and it's therefore very important. What they found was that people who had 4 or more adverse childhood experience was associated weakly with inactivity, obesity, and diabetes. They were associated moderately with smoking, excessive alcohol use, poor self-rated health, increased cancer rates, and increased heart and respiratory disease. They were associated strongly with sexual risk-taking, with mental health challenges, and with problematic alcohol use. And they were associated very strongly with problematic drug use and violence to self or others. So what does this mean for us here? Well, there was included in the 2022 Cayman Islands Student Drug Use Survey some ACEs data. And it was reported that 30% of girls and 16% of boys have experience of 4 or more adverse childhood experiences. If we think about the impact of that and what we know, it is no wonder that we have drug use difficulties in our population, in our young population, and a massive self-harm issue. If we take those results and we generalize them, and I know I'm taking a bit of a leap here by doing, the figures on the back of a postcard, but if we generalize that, that represents 18,500 individuals in our adult population, if we understand the population to be about 88,000 people. So 18,000, we could never take care of those people in quaternary care. It's just not possible. There could never quite be enough psychologists, counsellors, psychiatrists to cover that type of population. So what we also saw was that 50% of girls and 36% of boys have reported physical, sexual, or emotional abuse. 60% of young people reported household challenges like domestic violence, and 30% reported neglect. So, what this leads me to is the idea that we need an alternative to a traditional internalized understanding of mental health challenges. We cannot leave it to the quaternary care to manage this. We've recently had World Suicide Awareness Month, and the theme of that was looking at changing the narrative. And it's something that really struck with me and something that I've really ridden on since then. It's moving away from the idea that there is something wrong inside of us, with a person or with ourselves. Because what that does is it encourages an us and them narrative. It's I'm not like that. That's them over there. There's something wrong with them. It allows us to other. And all types of discrimination going back through history have been about othering. And that allows us to deliberately misunderstand people and to use that for our own power. And it's never okay to deliberately misunderstand anybody and use that for your own power. So it increases a sense of not being able to understand, a sense of not being able to help, and a sense of fear. And by understanding mental health issues, not as something that's gone wrong inside of us, but as things that have happened to us, it totally allows us to step away from that misunderstanding to a place of complete understanding. So I'm going to talk about the biopsychosocial model because this has been the underpinnings of psychological and psychiatric theory for probably the last 2 decades. No, not the last 2 decades. I've been around a long time. Maybe the last 10 to 15 years. Okay. In modern mental health, there is now a growing emphasis on recognizing the social determinants of mental health challenges, as well as their impact on recovery. So we used to understand that they were all equal, the bio, the psycho, the social. And actually what's being understood now is more and more so actually is the growing importance of understanding the social part, and that is playing a bigger role in our understanding of mental health challenges and their emergence in the young population. So the role of adverse childhood experiences, poverty, social exclusion, debt, housing and unemployment are now being seen by the World Health Organization, the US public health system, and the NHS as being central to the cause of mental health challenges and also at the root to their solutions. And that's why we cannot just leave it to the professional mental health people like myself to fix this, to help. It has got to be everybody. It's got to be everyone in society. It's got to be part of the political system. It's got to be part of legislation. And it's got to be part of every policy that is written. So let's talk about changing the narrative. We had World Mental Health Day. I'm going to keep coming back to this because it felt so important. And World Mental Health Day looked at mental health in the workplace. And then we had International Suicide Prevention Day, which looked at changing the narrative, which is moving from the idea that it's only counsellors, psychologists, therapists, and psychiatrists who can deal with mental health issues. I met a teacher recently, and I had the privilege of spending a good few evenings with her. And she was singularly one of the most compassionate people I'd come across. She was so empathic. Just her tone of voice signaled that she was a safe person to talk to. And I thought, I'm so glad you're in one of our government schools. You are amazing. And she said to me, well, actually, Dr. Basson, I've been asked not to use those skills to talk to the children. I've been asked that if somebody comes to talk to me, that I pass them on to the counsellor and that I shouldn't ask any questions and just move them on. And she was really, she was devastated by that, because here we had somebody who had the power and the reach to touch so many people, especially in a young population, who was not using it. And so we spoke for a little while, and I was trying to encourage her to just start moving into the space where she could have some, first-level conversations with people, because people sought her out, and I totally understood why. If I was working in the same space with her, I'd be seeking her out as well. She made me feel better just spending time with her. And our children are desperate for people to talk to, for care, to be listened to, and most importantly, to feel understood. So I'm going to talk about the roles of acceptance, belonging, and connection. Anybody who knows me knows that I harp on about this. So if you've heard this a number of times, I'm just going to apologize right now and then not apologize. So, belonging, right, where we want to be and where we are wanted, versus where we want to be and where nobody cares less. That's fitting in. Okay. When we feel belonging, we are accepted for who we are. And in order to show people who we are, in order to have belonging, we have to show people who we are. And in order to show people who we are, we have to belong to us first. We have to feel comfortable enough in our own skin to feel belonging. Okay. To do that, we have to show our most authentic selves, okay? That, essentially, is what made me just grow out my grey, okay? Because I was like, I'm just hiding a part of me, because why? Why am I hiding this part of me when I've started going grey in my 20s? I'm not that old, also not that young. Right, thank you. Thanks very much. Very validating. Okay, connection. And by the way, I advocate for that because it is one of the most freeing things I think I have ever done. Okay, connection is the energy that exists between people when they feel seen, heard, and valued. We can both give and receive without judgment, and we feel filled up by an interaction, by that relationship. Okay, so who here has had an interaction today with somebody, and they've come away from that and they felt a bit filled up, they felt pretty good? I did this morning, yeah, okay. Who was just here for the food? Okay. It was pretty good, right? What you all know, okay, and I'm not going to ask if you have struggled to connect, but what you will know if you have ever struggled to connect in your life with others is when you do, the impact, the power of that connection is enormous on you. It's a healing experience. And it can feel so hard for so many to feel connection because of people hiding themselves, because of shame. And I'm going to talk about shame a little bit more as we go. Okay, and then I want to talk about acceptance. And that's when we share our authentic selves. We can be vulnerable, and we can still feel belonging and connection. These are the cornerstones of our mental health. That's what we all need as humans: acceptance, belonging, and connection. So what are we seeing at Alex's place? I is the wrong word, by the way. It's what are we seeing? And some of the team I work with are here today, and they are absolutely incredible. And I am very grateful. Every day I go in and work alongside them. So we're seeing crisis levels of suicidal ideation in young people, especially young girls, and there's no getting away from that. And it has the root causes in a number of different areas, and I'm going to go through them. So we're seeing really high levels of adverse childhood experiences. We're seeing high levels of intergenerational trauma. And so that's trauma that's kind of passed down either through interpersonal style or through experiences, generation to generation. And we see an awful lot of that with sexual abuse and with physical chastisement. then we're seeing an awful lot of ongoing sexual trauma. The number of girls that come into my office and talk about having been sexually assaulted, sometimes by people who know them and sometimes by people who don't, and there has been nothing done about those sexual assaults. It's really frightening. Okay, then we have issues with relational health. So young people are feeling at the moment that they can't talk to their parents, often wrongly, and they're assuming their parents won't understand. And there seems to be something to do with social media that's creating this massive disconnect. I'm going to talk a little bit more about that as well. There is a general, really understandable and very well-intentioned parenting approach, which is around performance, because if you don't perform here academically, it's going to be really hard to get ahead. And if you're going to perform well, you need to be obedient and listen. Okay, so you can really understand where that comes from, and that typifies a bit of a general style. Okay, but what that means is that there's less emphasis on listening and understanding and nurture, and it's that a lot of young people are attempting to get in often misjudged ways. Sometimes parents see their child's life if they've got it so good. And in so many ways, our younger population do have it so much easier than the population before, than the generation before, because of trauma, because of difficult experiences. Okay, but there are a raft of new challenges that young people are facing that we never had to face in my generation, that is actually making life quite a lot harder for our young population. And then we have isolation. Social isolation following the pandemic is massive. It was so stark to me. I had a 14-year-old girl sat in my office, and she made it so clear to me what had happened. She said, I was really sociable. I loved hanging out with my friends. I loved going out. She said, and then the pandemic hit, and I went into my bedroom. She said, and Dr. Basson, I never came out. And she said, I don't even know how to do that now. And I miss the person that I was when I was 11. But I don't know her anymore. And it's that social isolation that we need to reverse over time, that we need to first understand, because actually everybody went into their rooms. Everybody went into their rooms, onto their devices, and they never came out. And we have got to start coming out, okay? They tell me there are no gathering spaces for them. Adolescents have no gathering space. It's okay, they have Kings, but how many times can you go to Kings before you get bored? Okay, there needs to be something else. Many young people have difficulties with being LGBTQ, part of that population here, because of the difficulties around acceptance, belonging, and connection. And anybody who was at the APF symposium would have heard me talk about the impact of that on young people and discrimination. And then we have high levels of screen use and mindless scrolling. So through my work in APF, we're going to release some guidance in November. Guidance around what screen time and phone use is doing to our young people's beautiful brains. And ours, right? And ours as grown-ups. And what we can do about it. So look out for that. But the one thing I wanted to share with you today is the first generation to grow up with smartphones are now adults. And the younger they got their first smartphone, the worse their mental health now. And the data is terrifying. So I'm really looking forward to bringing out that. Okay, so just to continue with what we're seeing at Alex's place. We're seeing real difficulties with socioeconomic status. Young people seeing their parents struggle to put food on the table and worrying that if they share how they are feeling, they are adding burden to their parents' plate. And they have such esteem, such high regard for their parents, such love, such worry about how much they are struggling, they do not want to add to their burden. And that's really worrying. And when you tell parents that, they're like, oh my goodness, well, I'm so glad I know. And they tell their young person, I can deal with this and how you're feeling. So you tell me everything, okay? And it's young people who feel that they can't, and we need to change that. Then we have high levels of dissonance because of the massive economic divide. So many young people look around, they're struggling in their households, they're struggling for food on the table, and then they see people here with so much, and it's painful, and it hurts. And then young people have future issues. So they have high pressure, sorry. We have really huge amounts of high academic pressure, some intrinsic to school, some from home, and it's because it's hard to get on here. If you're not wealthy, if you don't come from a wealthy background, it's really, really difficult to make your way here, unless you get really, really good grades. I had a kid who came to see me and was absolutely devastated that they were on the honour roll and not the high honour roll. I was like, what? This girl had had like, I don't know, 5 A stars, like 3 A's and a B maybe and a C. And she's like, it's because of that B. I wasn't on the high honour roll, so I failed. I was like, wow, I didn't even scrape an A at GCSE. You are amazing. And it took me some time to process that that's how young people are feeling. Okay. So young people are seeing themselves, and other people are seeing them as only good as their grades. And nobody should ever feel that they are like a letter on a page, okay? And then they have future issues, not able to see themselves doing well, hard to get on here, okay? And then the global context of the climate crisis and the financial crisis. Excuse me. So, again, I love listening to the people that I work for. And one young person said to me, I felt like I've been displaced from this island because of financial issues. She said, now I feel like I'm going to be displaced from this island because of the climate crisis. She said, how can I possibly have hope when it's like that for me, Dr. Basson? I mean, what do you say to that? Nothing in my doctorate taught me how to respond to that. You know, because she's right. I'm like, yeah, okay. We've got 55 minutes left in the session. What? Yeah, okay. So, why do these cause mental health difficulties? It's because they disrupt our sense of acceptance, belonging, and connection. And when we're not talking about how we're feeling, we're not sharing our authentic selves, when we're hiding something about us, you know, when we feel like we're not doing good enough, when we're not talking, we're not connecting, we cannot get belonging. And then our sense of ourselves and the world is totally disrupted, okay? And young people are finding it very, very difficult to have any kind of hope here, is what I'm seeing. And then we have shame. So shame starts from the moment we can move as babies, okay? As soon as we can move, of course what we hear is, don't touch that, you're gonna burn yourself. Oh, come back from there. Oh, no, don't do that. Okay, so we're starting to be corrected. Correction very naturally leads us to shame because it makes us think I'm doing something wrong. I'm not good enough here. I need to do better, okay? What we then do generally as parents is we balance that with lots of you are amazings, cooing, like tickling the toes, counting 1, 2, 3, this little piggy went to market, okay? Those messages alongside the correction say to a child or a baby, you are awesome. And that's what we need. We need the both and, okay? If we don't have the both and that connection with a baby requires so much presence as a mother. You will know that when you are exhausted, when you have not slept, when you are just pleading with your baby to go to sleep, okay, I've been there, you cannot connect properly because you are exhausted, okay? If you have had trauma, then trying to connect with your baby and your child is 100 times harder. Trying to mitigate that shame is very, very difficult. And then as children, if we are corrected and corrected, or even worse, if we are abused, that behavior defines us. And actually, it can do nothing but define us. We become, as children, how we have been treated. We allow, and we can't do anything but allow that behavior to make us become who we are. So we become not good enough. And that is the sense of shame. We all have it. Shame is not a you and an us and them thing. It's an us thing. We all have shame. I have shame. You have shame. You have shame. We all have it. The reason that we don't know we all have it is because we hide it, because it's the bit inside us that says, you're flawed, there is something wrong with me. It's me thinking here, if you knew this thing about me over here that I haven't told you about, you wouldn't be sat here listening to me. You'd be thinking, I'm not listening to her. Did you hear about what she did? Right. Okay. And when we have shame, that's essentially the root cause of all mental health difficulties, because it's the I'm not good enough. It's that negative internal voice that we all have. Okay. I'm going to talk a little bit more about that. So how does all this link to everyday therapeutic conversations? It's because we're all human. We each have multiple roles, okay? Today, maybe you're sat here as a doctor or a nurse or a physiotherapist or an occupational therapist. When you go home, maybe you're a parent, a partner, a daughter, a son, a brother or a sister. When you go out, you're a friend, you're a cousin, you're a confidant. At some point, we are all a patient, okay? So, I want to tell you about the power of a couple of therapeutic experiences I've had. I went into the early menopause, okay, late last year, earlier this year. I was like, thank you. Moved halfway across the world, moved my family, trying to get a better life, and then bam, right? I was like, wow. And if you have been through that, oh my goodness, I am feeling you right now, okay? And I went to see my doctor because I was like, I'm going to murder somebody if I carry on like this, right? So I went to see my doctor, and I said, I'm just feeling absolutely awful. And I'm from the UK. I'm used to a 7-minute GP consultation, so I've got myself ready. Okay, I'm like, right, 7 minutes, I'm going to use them. I'm going to get in there straight away. I'm like, right, like this. And my doctor's like, all right, Chantal, calm down. Okay, it sounds like you're feeling awful. And I was like, I really am. I was like, I don't know what to do with myself. And she spent 20 minutes with me. I'm like, how much am I paying for this? You know? So she spent 20 minutes with me, just talking about not just my symptoms, but how was I doing. And honestly, I was not doing great. My mental health in that moment was not at its best. I was not at my best. Okay, but she really helped me. And although it didn't solve all my symptoms walking out of that room, it improved my mental health enormously. It was the start of me getting myself on track into a new phase of life, accepting me for who I am with my greys and my HRT and all the things that come with that. Thank goodness for HRT, that's all I can say. Thank you. You feeling me? I appreciate that. And then I had another bit of a whammy. I went through some health difficulties this year, and it felt pretty serious. And I thought, how long have I got on this planet? Okay. And I'm sat waiting to see my doctor. Again, same doctor. And I thought, thank goodness, she's the one person whose face I want to see right now. I'm sat in the waiting room, and my anxiety is like 11 out of 10. I'm like, what am I going to hear? Am I about to be told that I'm going to be leaving my children soon on this planet? And I was like, wow, what is going to happen? How am I going to feel in 5 minutes? I was like getting up, getting down, fidgeting, looking at my phone. You know how it is when you have anxiety. I was really anxious. And my doctor came out to see me, okay, and I was like, and I got up, and she just looked at me, and she said, whew, Chantal, you've been going through it, haven't you? And in that moment, like, all of my anxiety disappeared, because she saw exactly what I'd been going through. So one of those interactions lasted 20 minutes, and one lasted about 10 seconds, and both were as equally powerful. So I want to talk for a moment about mental health in the workplace, okay, because that's what Mental Health Day was all about this year. And as Dr. Reverend Yvette Noble Bloomfield said, we need trust when we're at work. And I was so grateful that she was talking about that, because our relationship with our boss has a similar impact on us to the one we have with our partner, spouse, or parent. And it's so easy to experience blame at work, either to blame others or be blamed, and that sends us into shame. Okay, blame is the verbal expression of discomfort and pain, and it has an inverse relationship with accountability. Okay, taking accountability is very vulnerable, and blame encourages defensiveness, right? So I'm a really compassionate person. Okay, anybody who knows me will know I have an abundance of compassion, apart from with my husband. Okay, so I'm getting up one day, I've got 2 young children, they still need help to get themselves ready to get out the house to school. I'm running late, my house is a mess because my skills lie in other areas than housework. Okay, so I'm getting them ready, I'm flying out the door, I'm looking at my kitchen, my aunt's arriving a day later, and I say to my husband, please will you sort out the dishes and do the dishwasher? Okay, here's my shame, I've not done the dishes the night before, shock, horror. Okay. So I'm running out the door, feeling bad, I'm late. I'm running late to get the girls to school. Of course I'm running late, it's like standard. Okay, so I'm like there, I go into work, I've got kids coming in, like I'm up to here with that. And I pick my kids up, I'm nearly late picking them up in the evening, and I get home and the dishes haven't been done. Right. So my husband walks in, he's like, hey. I'm like, hey. He's like, okay. I'm like, what are you doing? Why have you not done the dishes? Okay. He's like, oh my God. He's like, I was called out. I was like, oh, right, okay. I'm still cross, but okay. So I went straight into blame. No compassion, straight into blame. Okay. But here's the thing. That blame was the expression of my discomfort and pain. My discomfort and pain is, I wish I had more time to spend with my children. I wish I wasn't rushing around. I wish I had got some genes that made me good at housework, because they passed me by. Like, my mum was really good at housework. My sister's got a pristine house. I was like, where did that go wrong for me, right? So my blame of him was my sadness at myself. And when we think about it, we know that when we blame others, and we do blame, we are humans, we love to blame, okay? When we blame, we are really just trying to mask our sadness at ourselves. And that's extraordinarily vulnerable. If I'd have been vulnerable in that moment, non-blaming, I would have said to my husband, look, I'm really disappointed that you didn't do the dishes. But what I'm more disappointed is I don't have more time to, firstly, do them. Secondly, like, make a good job of this parenting malarkey boat that I'm on. You know, and thirdly, that I was just kind of an all-round sort of better mum, wife, you know, those things that aren't anything to do with being a psychologist, because I knock that out of the ballpark most of the time. Okay. So when we can step away from blame and into our vulnerability, we have compassion for ourselves and we have compassion for others. Okay. And that is the difference then when we receive compassion. We step out of our blame and out of our shame, of our pain and discomfort, and into a place of compassion. And compassion makes this world a way better place for us and for other people. So I want to talk for a moment about compassionate leadership. Okay. Compassion is the awareness of suffering of another, leading to action that alleviates suffering. Okay. It's about listening with fascination. And if you want to hear more about that, there's an amazing woman called Kristin Neff who talks about listening with fascination. It's that listening without trying to form your next sentence. I'm terrible at it. I'm always waiting to talk because, well, look, I'm stood up here, right? So it really is that listening without wanting to say the next thing. It's about understanding what you're listening to, empathizing, and then intelligent action. And the beautiful thing about this is that we are all leaders somewhere. You don't have to be in a leadership position to use compassionate leadership. You can use it as a parent, you can use it as a teacher, you can use it as a TA, as a nurse. It's about how we show up anywhere on any given day. It allows us to be our true, authentic selves, and it fosters acceptance, belonging, connection, hope, and, most importantly, accountability. Because when we're not afraid of being blamed, we can own our mistakes so much more easily. And let me tell you, I make them, right? I'm a big mistake maker. The upside of it is it makes us loyal. It makes us loyal to an organization. It improves productivity, just as Dr. Reverend Yvette was talking about earlier. And it results in fewer sick days, just as she was talking about. But it's not just about using it in healthcare. It comes from healthcare, and I learned about it through Professor Michael West, who runs the NHS staff survey yearly. He's a really inspirational person. But actually, what it taught me was from using it in the organization where I was in leadership, I started to use it just in every arena of my life, and it made a huge difference. And I'm working on it with my husband, okay? He knows it. So the questions that we ask are, how is asking for help responded to? How are mistakes responded to, right? And that's definitely something that I'm working on with my husband, because he makes a lot of mistakes, and so do I. It's about moving from that blame-shame cycle to the, I'm so glad that you told me about that, and then empathizing. Oh my goodness, it just sounds like you're feeling awful. You know, it's okay to feel awful. It's totally normal. How are you doing right now? And then accountability. What do you want to do about it? Compassion is not about being soft. You can be compassionate and have rods of steel boundaries. And I think that's when the two things go really well together, because we can do the empathy, and then we can do the, so what do we need to do about it? What do you need to do about it? And then you help somebody take accountability for their behavior. Because when we make mistakes, we have to repair. We do have to. We can't just be nice and let it go. We've got to stand up and step into that space and sort it out. I made a massive mistake once. Well, actually, yeah, it was a mistake. I was again late for school. I'd forgotten my daughter's swimming costume. And I was racing to school because I had a coffee in that morning with one of my all-time gurus. And I was going to be late, and I was stuck in traffic, and there was an accident. So I'm like, you know, when you're up here. And I called her, and I said, I'm so sorry. I was 40 minutes late for coffee, and she had waited. I was just like in my biggest shame space. So I apologized, and I bought her the coffee, and I thought, that's not enough. That's not enough of a repair. So I went down to Vigoro. I bought her a little plot plant, I bought some ribbon, tied it round, dropped it up at her office. She was like, wow, you know. And you know what? I felt so much better, because I felt, yeah, I have taken accountability for my mistake. And it allows us to have a sense of self-worth, because we are worth making up with. Okay, she showed me that I was worth making up with. And that's really powerful. Okay, but we can't have compassion for other people unless we have compassion for ourselves. And self-compassion is the practice of being kind and understanding to ourselves as we would to a friend when we're facing challenges, feeling inadequate, making mistakes. Okay, it's about combating that really negative inner voice. Okay, I'm a really bad driver, right? If you see me on the roads, just steer clear, okay? Because there's a reason, right? I get into my car and I switch off. Okay, that's when I start to process my day. Okay, so you'll see me like behind the wheel, and then I'm like, well, how did I get here? And then I like cut up 5 people, and you know, beep, beep, beep. I'm that person, okay? So I miss my turnings a lot, and I used to. When I missed a turning, I used to be like, oh, you're an idiot, Chantal. And then I was like, hang on, you're calling yourself an idiot. Is it okay for anybody to call you an idiot? I was like, no, it wouldn't be okay for anybody to call me an idiot, so it's not okay for me. But I grew up without acceptance, belonging, and connection. I grew up with an emotionally distant parents, and I was called names, and one of them was an idiot. And so that's become my inner voice, because that's what happens to us as humans. So that's where I started my self-compassion journey. I noticed when I called myself an idiot when I was driving, because I did it a lot. And I said to myself, hey, Chantal, you're not an idiot. You missed your turning. Loads of people miss their turnings. Okay, maybe you do it more than most, but that's also okay. It's all right. So, loads of people miss their turnings. It does not make you a bad human. You are a good human. You're just not a great driver. You can hear the self-compassion in there, right? And when we can do that for ourselves across all of our spaces, we become way more compassionate. We start to move that inner voice from where it was. And we start to be able to be more compassionate to others. So, let's think about the power of the possibility of these everyday kind of therapeutic relationships with ourselves and towards other people. Because you do not need a doctorate in clinical psychology to do any of this, okay? So they're short but powerful moments of connection that help us feel seen, heard, and understood. They can happen anywhere, in the supermarket, at kids' parties, at the doctor's office with a nurse, when they're taking your blood pressure. I love those moments, by the way, before I see a doctor. Have a little chit-chat. It's always a moment of connection for me, because I love nurses. They are some of my all-time favourite people, especially where I grew up in the NHS. It can happen when you're picking up your lunch, okay? They're not solution-focused moments. You don't need any skills to do any problem solving. So we ask, how are you, as a throwaway. I do it a lot. I've done it today several times. Hey, how are you? And I'm off. Okay, I didn't hear the answer, which is not okay. And you rarely get an honest answer because of it. If somebody's coming to an appointment with you, or you're going to an appointment, it's circling back to that moment when you've got that conversation going, when you've got that rapport, and how are you doing? You're having a bit of a rough time. Or not asking someone how they are, but just like my GP said to me, you're having a bit of a rough time. Conversation starter 101, it was brilliant for me, that. It really changed exactly how I was feeling about everything. So, they can be 1-minute moments. They can be 3 to 10-minute conversations. See, I'm too short now to see my own slides. They can be hour-long conversations too. So, it's about listening more than talking, because when we really listen, when we listen with fascination, we can understand that a lukewarm okay is very different to I'm great. I've got a colleague who I absolutely adore. And when I check in, we've often got a packed agenda. And I'll often say to her, how are you doing? She'll often say, I'm okay. I'm like, oof, that's a lukewarm okay. Tell me about what's going on. Like 3-minute conversation, then we'll get into our agenda. But it just makes us connect. And I know she's told me it makes her feel a bit better. Okay. If someone needs more than you can give, then invite them back or ask them if they want formal help. So using open questions when we want to get something from somebody, and then when you're ready to move on, using closed questions, or my personal favourite, so what are you going to be doing after you leave here today? It's a great cue for, we're finishing now. Okay, so don't be afraid to get into the conversation, because then you've got the tools to get out. Okay. Let it be known it's okay to talk about emotions. I purposefully talk about mine because what I'm doing is I'm saying to you it's okay to own all this stuff. It's okay to be completely flawed and make all the mistakes and have all this shame and blame your husband and then repair. Okay. And often no wonder somebody is feeling overwhelmed. Okay. When we understand what somebody's going through, we're like, yeah. Anybody is going to feel like that. That's why mental health is everyone's business, because anybody can feel like that. Okay. We can use playfulness. I've used that an awful lot today. Acceptance, curiosity, and empathy. And by the way, this one, I'm not going to talk it through, but if you want more ideas about it, you can use the amazing Samaritans listening wheel. Okay, it's freely available on the internet. And really, the thing that we need most of as humans is empathy, because that's how we feel heard and understood. Because it's what makes something better, and that is the connection we feel when somebody gets it for us. It's perspective taking, it's staying out of judgment, and don't we just love to judge? It's recognizing emotion in others. It's communicating your recognition of their emotions. Okay, we might understand it, we've also got to say it back. And when we show other people empathy, we heal ourselves just a little bit too. So I'm going to show you this video.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
And so together, I wonder if we can make mental health everybody's business by allowing ourselves to be vulnerable enough to connect with our own experience in order to show understanding for each other. Because together we can change the narrative. Thank you.
We have room for questions, and we will make room for 3 questions if we can. So just raise your hand. I see one hand over there. And forgive me, I'm with glare, so if you're raising your hand, you could wave it a bit so I can actually see your hand as well.
People are terrified because I'm a psychologist.
Dr. Chantal,
Yes.
over here.
Where are you?
Right here.
Hey!
Yeah, you're not my friend like Dr. Bloomfield, but I like you. and I'll drop the mic on your presentation as well. That was awesome. That was really awesome. Enough respect. Especially the compassionate leadership and self-compassion. I'm really, really grateful for that. But what I also find interesting as well is when you raise the concern that young people have in terms of the economic concern. And it's very important for us to be mindful that Cayman is small, right? So everybody see things, our young people have various experiences. And one of the things that we tend not to pay attention to is that when your friend, when your family member go overseas, possibly, it was one situation, and they may study, and they come back home, and they can't find a place in the workplace, right? And then they hear the conversations of what I'm trying to do to find a place back home, having spent my time studying. That is a concern. I remember a young man that I used to work with at the boys' home, and he made mention he wanted to leave Cayman because he was not finding a place home. And he said this, I would never, every time I think about our situation here, I think about what he said. He said, all it would take is for somebody to go out to the waterfront and kill a tourist, and you will never hear the end of it. And that's because now our country would be considered unsafe. Now, this is several years ago. What a lot of people do not understand, because they do not walk the streets of our vulnerable communities, that there are things that are brewing in our communities, and it will take a matter of time if there's not a serious intervention, and we don't prioritize mental health. We are going to see things that we don't want to, because it will become unsafe, and then Cayman will not be what everybody's experiencing now. So when you are interacting with those who you may not necessarily know, because it's a culturally diverse country, remember those who are from Cayman as such, because they were born here and they've lived here for a long period of time. What we're all experiencing now is from the backs of those who worked hard in Cayman. And so we need to understand all of our experiences are valid.
I completely agree. And that's one of the reasons that understanding of mental health and the impact on mental health has got to be put in from the very top. There's got to be a mental health perspective on all policies and legislations, because we know from the research that that's what makes societal change for mental health. That's what makes a societal difference. And we have got to think about mental health from a political and a societal perspective.
I'm just giving a glance just to make sure. Okay, so we have a question to the right front.
Thank you, Dr. Chantal. Thanks very much for your presentation.
Thank you.
Thank you for being so
1 second, let's get the mic on.
so honest and vulnerable, for all of us to hear that not only do you help others, but you are in the same boat as so many others every day. So thank you for sharing that. My question is, we've over the years been addressing the needs of young people because we know there's a dire need. But children don't come here to parents with any manuals.
I wish.
And parents, so the focus has been on children. We know we have a parenting program, but when children are going through the stresses that lead to mental health crisis, they can come to Alex's place. Mm-hmm. What happens to the parents then? Like a child who is attempting suicide or who's on suicide watch, or a child who's struggling with LGBTQ issues, where is the intervention for the parent to help the parent to understand this is what's happening and this is how we work? We help you to work with the child to solve the problem.
Thank you so much for asking that question, because it's so extraordinarily important. We do work with the parents, and with my background in systemic family therapy, I will do my very best. But the capacity that we have doesn't allow for massive amounts of that, but I will always do at least some. And we do have, of course, the Family Resource Centre, who are doing a fantastic job. What we need really, though, is to start from those very, very early days, from conception to age 5. And I know that the research shows that when we look at maternal mental health from conception, especially in terms of like the younger the parent or the more ACEs they have, the better the outcomes for that parent and that child over the following 15 years. And so I would love to see or be a part of the growth of an intervention for maternal mental health and parent-child mental health with that focus, because I feel like it's really needed. But we do try our very best to look after parents when they come, because they are suffering. And as a parent to a parent, I will always let them know that I understand that. We don't do blame.
Dr. Basson, thank you very, very much. Let's give it up for her once again.
Thank you. Thanks so much.